My name is Dr. Yalamanchili. I'm one of the orthopedic spine surgeons here at Seaview Orthopaedics. I have one of my patients here, Brian, who's been very kind to give us some time to talk about his surgical experience and to help any future patients out based on his experience. Now, Brian, thank you very much for coming in today. Can you tell me a little bit about what brought you in to see me?
Back in February, I was raking leaves in the yard, and I had started with severe back pain in my lower back, which I've had problems with in the past, but nothing quite as bad as it was. And I talked to a friend of mine at work who was also operated on, and he recommended him. So I came to Seaview Orthopaedics, and I seen Dr. Yalamanchili, and he seen what my problem was, and he seen I was in severe pain. I would go as long as 48 hours without sleeping. That's how bad the pain was. And any pain medication that I would take wouldn't even touch the problem. I would be exhausted when I went to sleep.
Now, tell me, how long were you having the pain before you came to see me?
For over the years, I would have problems every now and then, and I'd go to a chiropractor, and I would kind of get straightened out, and within a few days, I would be back to normal. Maybe anywhere from 3 to 7 days, I could be out of work for a couple days because of it. But this time here, nothing was. I wasn't coming back. It wasn't getting better, and I laid around. I was out of work. I just couldn't get better. I couldn't get comfortable. I can't explain how bad the pain was.
Yeah, and when Brian came in, he had a very, very large L5-S1 disc herniation, and was giving him severe back and leg pain. Now, you had pain that radiated down your leg as well, right?
All the way to my foot, yes.
It was the right side?
Yes.
And did you have numbness and tingling?
Yes.
And what was worse? Was it the back or the leg, or was it both?
It was the back all the way in, almost down to the back of my knee.
And I remember when I saw you, you were having a lot of trouble even just walking.
Yes.
And we were going to try some injections, right? We were talking about seeing Dr. Myers, try some injections.
Yeah, but it was, I've had that done before, like about 19 years ago, and it worked for a while, but I knew I was past that.
Yeah.
I knew it wouldn't work.
So with Brian, typically we'd try some conservative treatment, some therapy, maybe some injections. But with Brian, it got to a point where this disc herniation was so large and the nerve was being so pinched, it was causing spinal stenosis, that the chance of those treatments helping him at that point was not too great. He was in too much pain. So then we talked about doing a surgery, and we talked about doing the minimally invasive surgery.
Right.
Which involves a smaller incision, less muscle dissection, but still to perform the same procedure to make space for the nerves and to help his pain. Now, you don't have to, but if you want to, can you show the people the incision?
Yeah.
If you don't mind.
No.
Just so they have an idea.
Can you see it?
And you can see here, this is a minimally invasive incision. It's not the traditional incision. Oftentimes when you're doing an L5-S1 fusion, you're talking about an incision that's 2-3 times the size. But for Brian, he had a situation where just a minimally invasive one, and it worked out well for him. You can kind of see. So describe a little about the procedure itself. How was it? How long were you in the hospital? What did you feel afterwards?
I was in the hospital. I was operated on a Friday morning, and I was released from the hospital on a Monday. I was in severe pain after surgery, but they had me up within 6 to 8 hours, make me go walk and stuff. But my back was getting stronger. I was getting better all the time. I didn't start no physical therapy for at least 2.5 months, though. Mm-hmm. And then once I started the physical therapy, I gotta say, Earl is also, he's the physical therapist here. I can't say enough about him neither. He explained everything to me and why I was doing it, and it worked 100% for me. I can't say enough about these guys.
Now, after the surgery, obviously you had pain in the back, the surgical pain. Did the leg pain feel different fairly quickly, or did?
Yeah, that went away.
It went away fairly quickly.
Yeah, that went away.
So that is a common occurrence after surgery. There's going to be surgical pain, and there's pain medication for that. The nerve pain for most people after the surgery, that goes away almost immediately, and sometimes it takes a little while, but usually it can go away immediately. Now, did you have any concerns about the surgery that you could help people with in the future? Something you wish you knew before or after the surgery?
Well, not really, but I will say I was scared to death and about having the surgery. It was the first time I was ever really operated on, and they set it up at Monmouth Medical Center, and those people, I went in a week before. They did all the testing for my blood test, urine test, and everything to make sure everything was fine with me. And the anesthesiologist explained everything to me, and it really calmed me down and made me feel better going a week before and telling me what was going to happen.
Now, do you have any advice for people in terms of like expectations, how long to recovery, what they should expect afterwards, or what they can do to kind of speed up their own recovery?
Well, do everything the doctor says. And, you know, if he says you can't do nothing for 2.5 months, you know, you got to do what he tells you to do and do everything the physical therapist says. That's what I did, and it's worked out for me.
Now, you're back to your regular work now?
Yes.
And just tell us again what you do for your work.
I work for Ocean Township Road Department, and I'm a heavy equipment operator. All the way, I could be running heavy equipment right down to operating the shovel also, and everything in between. So it's physical labor.
So, and I can see that you're happy with your outcome?
I couldn't be happier. I'm back to doing everything I love to do, hunting, fishing, and going to work. So.
Well, Brian, I want to thank you very much for coming in and speaking with us today.
You're welcome.
And I'm very happy that Brian had a great outcome, and I hope that all my patients can have such a great outcome. You know, we try our best here between the staff at the front desk, our clinical staff, and the hospitals that we go to make sure patients have the best experience they can. You know, as Brian said, it's very normal to be nervous before any type of procedure. Not everyone that comes in has a surgery, obviously. Some people get better without it. But if you do need a surgery, I want people to feel comfortable with us and where they're going, and that they can potentially have a very good outcome. Thank you again, Brian.
You're welcome. Thank you, doctor.